My whole career until I came here in the summer of 2010 was spent in the Army. Anywhere between Texas and Louisiana and Washington, D.C. and Hawaii and Washington State and Iraq, and eventually here. My wife's from St. Albans. After all the rotten places she had to live while I was in the Army, she told me that she was settling down in Vermont, and I was invited to come along. No one knows what a gastroenterologist does unless they've encountered us before. So we cover multiple organs of the body, pretty much the entire digestive tract, the pancreas, and the liver. Probably the most important thing we do as gastroenterologists is colon cancer screening. Colon cancer is one of the top 3 most prevalent cancers and biggest killers, cancer killers. So when we do a colonoscopy, we call it colon cancer screening. Most people, it's recommended that you have your initial colonoscopy for colorectal cancer screening at age 50. Guidelines came about 5 years ago now that suggested that African Americans start having their first colonoscopy for screening purposes at age 45 because there's a higher risk of colon cancer in African Americans. The other factors that would be a reason to have your first colon cancer screening at an age less than 50 are family history. That's a big one. So if you've got a family history of any first-degree relatives with colon polyps or colon cancer, you should have your first colonoscopy at age 40 or 10 years younger than your family member. Most people consider the prep the worst part of the whole experience. You have to typically drink 2 to 4 liters of a salty marsh water tasting stuff that cleans you out. And the colonoscopy itself is usually the easy part because we use 2 medicines to sedate people for the procedure. I had my first colonoscopy 2 years ago now, and I was terrified, even though I'd done thousands of them, because I'd never been on that end of the table. You know, just the thought of having a scope put in my bottom was scary. And you know, much like everybody that I scope, I realized as I was waking up and watching the end of it that a colonoscopy is not scary, pretty simple, straightforward procedure, even from the patient end.